What is healing like after eyelid ptosis surgery?
Eyelid ptosis is a condition where the upper eyelid is in a lower position than it should be. Ptosis, when not associated with a neurologic condition, is usually caused by a dysfunction of a muscle called the levator muscle. The word levator is like the word elevator without the letter E in the beginning. There are two types of eyelid ptosis in this category. The first is congenital ptosis, which is ptosis you're born with. The other is acquired ptosis, which is ptosis that occurs after you're born. In our practice, we see patients with ptosis every day, and during the evaluation, I'm always asked about the healing process. The healing process is very important for the outcome as well as the ability for the patient to go back to work or be seen during social events. I'll discuss how I evaluate my patients and provide guidance about the healing process with different types of ptosis surgery which I perform. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Eyelid ptosis surgery is a specialty procedure which is not typically performed by general plastic or cosmetic surgeons, but rather mostly by oculoplastic or oculofacial plastic surgeons. In fact, the presence of ptosis is often missed when cosmetic upper eyelid surgery is routinely performed for excess skin and fat. In these situations, the patients are distressed because they don't look better after undergoing surgery since their ptosis was not diagnosed or addressed. The strategy for ptosis surgery is dependent on the diagnosis of the type of ptosis, the severity of the ptosis, and the relative strength or function of the levator muscle. To optimize both recovery and to maximize accuracy, I usually perform ptosis surgery with local anesthesia and light IV sedation. Using local anesthesia instead of general anesthesia makes recovery from surgery much faster. Patients who are put under general anesthesia often feel nausea and dizziness after surgery. In addition, with general anesthesia, you're recovering from the effects of general anesthesia as well as from the surgery itself. With local anesthesia and light IV sedation, our patients recover from anesthesia immediately and they feel fine. The aftercare process is important for optimizing recovery after surgery. Unless otherwise instructed, I have patients apply cold compresses to minimize swelling for the first 48 hours after surgery. Antibiotic ointment is applied to the sutures where appropriate. A common form of ptosis we treat is acquired ptosis related to age, the use of contact lenses, eye rubbing, and allergies. Generally speaking, this type of ptosis is mild with good levator muscle function. In this situation, I often perform ptosis surgery by shortening a muscle from the underside of the upper eyelid. If there isn't extra skin to remove in the front of the eyelid, there's no visible sign of you having undergone surgery. The recovery from this type of ptosis surgery is generally the quickest. For example, I performed this procedure for a doctor who went back to work in 2 days. I do advise my patients to take a few days off to allow for the healing process and dissolving of internal sutures. I often use this technique for people who've had cosmetic eyelid surgery done elsewhere and learn after examination that they also happen to have ptosis. By performing the surgery from the inside of the eyelid, these patients feel better about having the surgery performed without having any new incisions and sutures on the outside. Ptosis surgery for situations where the eyelid level is blocking the pupil or center of the eye with good levator muscle function is often approached by performing surgery directly on the levator muscle. At the same time, I often perform cosmetic blepharoplasty to address excess skin and fat to get the best cosmetic result as well. This approach is often used for age-related acquired ptosis as well as in cases of congenital ptosis. The recovery is comparable to upper eyelid blepharoplasty, where sutures are removed in about 1 week and some swelling is present and it diminishes over the next few weeks to months. In some situations, such as in Asian eyelid surgery and congenital ptosis, the swelling can remain for longer periods and even last longer than 6 months. A less common situation is when the levator muscle has poor to no function with the eyelid level blocking the pupil. In these situations, I perform a procedure called a frontalis sling. This is a surgery where a connection is made between the eyelid and the muscle which lifts the eyebrows, called the frontalis muscle. I place a material such as silicone, Gore-Tex, or EPTFE, as well as the patient's own or cadaver-sourced tissue from the leg called fascia lata. Generally, recovery is about 1 week with some degree of swelling which clears over the next few weeks. Ptosis surgery occasionally requires revision for situations where the eyelid level may be too low or too high. When enhancement is appropriate, I usually wait about 3 to 6 months after the initial surgery to allow for the clearance of swelling. The longevity of the benefits of surgery depends on the type of surgery performed as well as the age and other factors which are individually relevant. If you're considering ptosis surgery or you're concerned about one or both of your upper eyelids being lower than you feel they should be, a proper diagnosis is the first step. This first step can involve seeing a neurologist, ophthalmologist, or an oculoplastic surgeon. For the types of ptosis discussed, the healing process and functional recovery can range from days to weeks, with some exceptions. I hope you found this information helpful. Thank you for your question.